Did you know that goosebumps, deja vu, flashes of lights are all signs of epilepsy that are missed by many? Well, there are actually more common symptoms of epilepsy that people miss. In this video, I'll explain all different signs of epilepsy so you can pick them up and control epilepsy early on to get the best treatment results. I'm Omar Danoun, an epilepsy specialized neurologist and epileptologist, and I have helped thousands of people worldwide regain control over their seizures using the latest advancement in epilepsy treatment. To start, let me show you how seizures happen in the brain. Epilepsy is an excess electricity in the brain leading to seizures. Think of it as flipping the light switch on. Similarly, a seizure dramatically triggers the function of the affected brain area. And to explain that, let me get the brain. One of the most dramatic locations for epilepsy is this area, the temporal lobe. So deep in the temporal lobe, there is the hippocampus, which is where the memory forms. A seizure here will start with a feeling of deja vu, because anything that comes out of the hippocampus is processed as seen before. So when the signal comes in and then out, you will feel that this happens to you before. The opposite can happen also, which is called jamais vu, which is feeling unfamiliar. So no wonder when you have a seizure, you don't remember it because it is happening in the heart of the memory area. So the brain is not coding memories like you have a pen but is not writing on paper. Common symptoms is raising sensation in the stomach or chest. I had a patient who kept having stomach pain and events that he was having, and he went to the primary doctor and he got to refer to a surgeon. All the testing in the stomach was normal, so the surgeon did what they do best: surgery. He took out the gallbladder and the appendix, and guess what? The events did not improve. Then I saw him and he had a big generalized seizure and he was diagnosed with temporal lobe epilepsy, and the testing of EEG showed that, and he was put on the right medications and seizure stopped. So he did not need surgery, he just needed the right diagnosis. Other symptoms are bad smell, bad taste in the mouth, metallic taste, hearing voices. One patient told me that he hears one line in the Star Wars movie every time he has a seizure. In the left temporal lobe here, when seizures happen here, it will spread to the left side of the brain where the comprehension and language happens. So the patient will have sudden pause, can't speak or can't understand what you are telling them, often will pick on themselves, have mouth and lip smacking, or even vomiting. If you go a little further in the amygdala, which is the emotion area in the brain, then seizures can start with laughter, which is called gelastic seizures, or sadness and crying, which is called dacrastic seizures. The gelastic seizures can also happen from hypothalamic hamartoma deep in the brain. Remember Michael Scofield from Prison Break? He had that condition. The temporal lobe is connected well. The seizures can have autonomic features to them, and one can be goosebumps. And it usually happens on the opposite side of the seizure onset. So left temporal lobe epilepsy will cause right-sided or right hand and right arm goosebumps. I have seen that in one of my patients when he was having left temporal lobe seizure, and his right hand had goosebumps and his hair was standing all over. And then when the seizure stopped, goosebumps went down. Other autonomic systems can be sweating and heart racing and palpitation. That also can happen. One dangerous sign is ictal asystole. The seizures, especially in the right temporal region, can cause the heart to stop. I saw multiple patients with this condition, and we placed pacemakers to avoid sudden death because of the heart stopping. It seems like the seizure activates the parasympathetic system so strongly that instead of just slowing the heart rate, it will completely stop it. This can be tricky to pick up, and really it requires professional help. If you are experiencing this and want to get to the bottom of it, check out the link in the description below and book your one-on-one consultation today. Okay, let's go to the weirdest seizures in the brain, the frontal lobe. Seizures often look bizarre and can start out of sleep and are called hypermotor seizures. The patients will wake up screaming, bicycling their legs, running, confused, and can say or do things that they will not remember. It can happen many times a night. This child wakes up confused and starts running in the house. Notice the drooling as part of the seizure, and he is unaware of what he's doing. It was described more than 100 years ago by Dr. Hewlin Jackson, who noticed the seizure starting in one limb and moving to another and called it, well, Jacksonian March. He described it in his own wife. Back in the frontal lobe here is the motor area. Seizures here starts with jerking in the opposite side of the body, starts with jerking in the face or arm or leg, and then keeps moving.
You okay? Yeah.
The frontal lobe is full of personality and behavioral centers. Seizures can start with sudden laughter, screaming, and swearing. Yes, I have seen it all. An obsession to touch or to drink or unable to speak. Moving next to the parietal lobe. This area is responsible for sensation, so seizures can start with sudden pain, tingling, dizziness, or other sensation that can be in one side of the body, usually the opposite side where it's controlled. And if we keep going back, then we reach the occipital lobe. This area is the vision area. So turning it on will cause visual hallucinations, seeing flashes of light or bubbles, or movements in the eyes themselves, like jerking from one side to side, which is called nystagmus. Other symptoms can be vomiting, dizziness, headache, and even blindness in one side. One patient had a long occipital lobe seizure right in front of my eye. I was testing the visual field and the patient could not see all the left side of the vision and was not even aware that the patient was having a seizure. Okay, these are examples of focal epilepsy. Let's talk about generalized epilepsy. In this type, the electricity is all over the brain, so we see things reflecting in the whole body. Think of it, electricity jolting the whole brain and body. So first it's called myoclonic jerks, when the whole body jerks, and which is mostly happening in the morning hours. The second is staring spells. The kid will stare off into space for a few seconds and was called before petit mal seizures, so which means small bad. And the third one is generalized tonic-clonic seizures, which is called grand mal, which is big bad seizures. This is the one you see in the movies all the time. Seizures can start in the whole brain, which starts with stiffening all over, which is called the tonic phase. And then shaking all over will be followed, which is called the clonic phase. So that's why it's called tonic-clonic seizures. It can be associated with tongue bite, urine incontinence, or bowel incontinence. Then the bad seizures, which is atonic seizures, which causes sudden loss of tone all over, leading to falls and then dangerous injuries. These types of seizures can really be bad. If you want to control your seizures well and make them stop, go watch this video next. I will teach you exactly how to control your seizures and epilepsy very well with the latest treatment available. And stay healthy and see you in the next one. Salam.